All right, guys. So this is our presentation in kind of education training on the COFA Premium Assistance Program to OHP transition. As we know, with Oregon Health Plan, we are going to have a number of folks that are going to fall into our Medicare programs. Some of our folks are over the age 65 and have long-term disabilities as well. So we have supporting a wide gamut of individuals that need that extra help, and this is where you all come in. We have 5 different organizations that are all assisting. Some CAN, which you guys are all representing definitely now. I've got a lot of you guys on here today at this time, which I'm so excited about. I think Teresa over from Keon. We also have ERCO, OMCA, and MIC. So with everyone's help, we're going to work on splitting all the contacts up for everyone to be able to assist with the phone outreach campaign and helping people get enrolled in the medical benefit that they should through Medicaid. So today we are going to go over our agenda, a little bit of background on the program, where COFA Premium Assistance Program is right now, what our phone campaign outreach is going to look like, the application process for signing people up, some common barriers and things that we may run into as we're going through that process, CCO enrollments and next steps, tracking and reporting your progress. So we will have a weekly report you guys will send to me so I can keep a track of where folks are in reaching community members, project timeline, and then section 4 questions as well. Okay, so for background on the program, I know this is going to seem a little redundant for the majority of folks that are on the call right now. We had a bit of a different group in earlier, so I just want to make sure everyone is on the same page. So I apologize if you all know this information already, but we of course are here today helping COFA community members access Medicaid benefits because in December 28th of 2020, Medicaid was reinstated for just medical only for the COFA community. Part of that process, we was updating the one applicant portal in order to recognize the COFA immigration status as an eligible immigration status. That update in the system went into effect March 10th of 2021. With that update and with Nina's work and other folks that have been assisting in the community, at this point, we have a little over 1,000 individuals in the community that have full medical benefits, which is amazing and fantastic. I know that's a stage in step 1 to all the support that folks need, and that's why you all are here. Now, what we're really trying to do is make that last push for the few individuals that are left on the COFA Premium Assistance Program, help to reach them and get them moved over to Medicaid. So we'll go a little bit over where COFA Premium Assistance Program is right now, what's happening, and kind of why it's important that we need to reach these community members. So of course, the program, because folks are eligible for Medicaid, the program is phasing out and will stop paying people's premiums and help stop paying this financial assistance at December 31st of this year. There are, and this is a number up to date as of today, thanks to Nina for getting me an updated list, and about 279 individuals that are still enrolled in this program. And the reason why it's really important that we reach these folks is that we want to make sure that they don't end up losing their coverage if they don't get auto renewed for the next year. We also don't want them to get stuck being sent bills for their monthly premiums, and we want to just help transition to the care and health insurance that they should be on at the moment. I'll go over a little bit of details too about how the community is broken down by county. But one thing I wanted to mention as well is that there are 62 of this 279 individuals that have some form of Medicaid benefit right now, but are simply just missing their immigration status. So there's a few folks that will be easier for us to adjust and get to full benefits. Some, a majority of the folks need brand new applications to be completed. We also have roughly 50 folks, 52 individuals that are age 65 or older and will need assistance with Medicare enrollment. Well, at least extra steps with interviews, say through the Aging and Peoples with Disability Department as well. And Nina, did you want to add anything at all that I missed? I know last time we talked about filing taxes and stuff like that. I wasn't sure if there's anything you wanted to add.
Well, I was just going to say, thank you, Sean, that we will continue to message to our COFA enrollees and past enrollees for a few more times going into the new year. We will have uh, a newsletter going out this week to email addresses that we have to remind them that they can apply for OHP Medicaid at any time during the year. There's no open enrollment period, as well as we have translated our final disenrollment notice. So they got an English version a couple of weeks ago, and then we had it translated into the 4 main COFA languages that we have been communicating in, and that will go out probably later this week. And again, we'll have more messaging going out after the first of the year just to remind them of things.
Awesome.
Thank you, Sean.
Yeah, of course. Thank you, Nina. And again, as we mentioned in our last call, it's just as much as we're all pushing together to help these folks get connected to the resource, the better. So thank you so much for all that hard work that you're doing on your end as well. Let's see here. So I tried, because I know folks had requested this so that we can have a better understanding of how to split up the members that need to be reached amongst the 5 organizations that are going to be supporting, kind of based on region as well as language support need. Now, when it indicates what country folks are from, or where they're from, that doesn't necessarily mean they 100% need a translator. But what I'm trying to do is try to provide as much information upfront so you guys have access to that data in case you want to help split it up with someone within your team that maybe speaks Chuukese or Popayan or Marshallese and split it up that way as well. So we, as I mentioned, have 279 individuals across a few counties, mostly within the metro region, Clackamas, Multnomah, Washington, Willamette Valley, Marion, Polk, and Benton. There's one person in Benton. Eastern Oregon, Union and Umatilla, and the coast region, Clatsop and Lincoln. So the majority of folks that we're going to be reaching are going to be Metro Willamette and Eastern Oregon. This is, I'll send you guys these slides as well so that you have them as a resource. But this is the breakdown they have right now of where folks are from and the support that they may need. All right. I know, again, a lot of information was stuff you would have known already. Any questions before I jump into the COFA phone campaign outreach stuff?
There was a question, Sean, from Teresa for Nina. Is there a copy of that newsletter that they can post on their organization's Facebook page? Nina, they're wanting to know.
Yeah. Yes, I messaged back to Teresa individually, and we'll add her to the listserv so that we can get it out to her.
Great, thank you.
Awesome, and that's a really good thing, and maybe we would should follow up too and make sure all the folks that are assisting with the outreach are on that listserv as well. Do you mind if I follow up with you and get you those emails?
Of course.
Awesome.
That'd be fine.
Yay! Okay, good. So I have a very chaotic list of to-dos I have on my side here. Okay, great. Yay, okay, awesome. Okay, so for the reason why you guys are here is, of course, that we're going to be, I've been given permission working with both Nina's team and OHA and my team to provide limited information for these enrollees to help you guys reach out to them. That's kind of been coined as the COFA Premium Assistant Program phone outreach campaign. And so we'll go over kind of your role, what the phone call might look like, as well as some other steps as well. So your role as a community partner, each organization will securely receive a list of COFA Premium Assistance members. It's going to be, at this point, to protect people's information and to make sure we're sharing the least amount of information possible, their first and last name, their phone number, and potential language assistance need as well. The goal is for between the 5 organizations for everyone to be called that is on that list. Hopefully we'll be setting up appointments, whether it be virtual or in person, depending on clients comfortable, whether the client is comfortable as well as whether you are comfortable, to help people apply for Medicaid through the One Applicant portal. Hopefully once approved, assist them in disenrolling in their marketplace health coverage, Providing health system navigation, such as getting connected to their primary care doctor, helping them understand the basic usage of their healthcare, as well as continue to have that partnership with those community members to have hopefully long-term ongoing assistance as well in the future, especially when you get back into having to do renewals and things like that in distant moments. Just as a reminder, there was a COFA Premium Assistance Member communication that was sent out on, let me see, that was sent out on Monday, November 29th. It was just a short notice to let folks know that their COFA Premium Assistance Program is ending, that the premiums will stop being paid, and that there are organizations out there, CAN and NEON and other folks that can help with their enrollment in the Oregon Health Plan. It was translated into Marshallese, Chuukese, and Ban, thanks to support of you all. And the hope was just to notify people ahead of time so that they weren't so alarmed if they started receiving calls from your organization. As I mentioned earlier, one of the most important pieces and things that we want to make sure that we are doing is protecting everyone's personal identifiable information. The first thing we did, of course, is limit the amount of information we're sharing. That was the most important part. You will have, as mentioned, a secure email sent to you with a Excel spreadsheet. You'll be able to track all of your guys' progress. If you can, kind of some do's and don'ts is to have a password to make sure that the Excel spreadsheet is password protected, so that anything, or that your computer that you're using, your network you're using, also is password protected. For when you're storing any printed copies or materials, that they are in a locked drawer or cabinet. Yeah, my little one just came home. I don't know if you can hear him. He's having a tough time. If there's any physical copies, and of course, if things are virtual, that they are kept secure on a secured server, however your organization keeps protected information. Forms need to be kept for at least 6 years. That's going to be consent forms and documentation that community members share with you. And of course, one of the biggest don'ts is do not share the information that is sent to you, the lists, with outside of your organization. So you could share that securely within your own team, of course, if you're, say, sharing the list amongst different people that are going to be tackling a portion of the list. But we want to make sure that this is secure as possible. And then, as I mentioned, folks will be sending me a weekly update from each organization of how many folks you're able to reach, so that I can add things to a master plan and kind of keep track of where we're going within the project. So first thing, of course, after you've reached or received your list, is the phone call messaging. So as I mentioned, there is a supplemental toolkit that is going along with this that has more information in it that's in here. We just tried to go and have the overview of things that we wanted to talk about today. So kind of some step-by-step process is when we're reaching members, of course, is to ask to speak to the member, identify yourself, the agency that you work for, explain why you're calling, and we have some talking points on the next slide. Ask if you're able to help them with their application, help them apply now, and if not, to schedule an appointment at a later time. To emphasize that your assistance is free and what your role is, letting them know what information they may need for an appointment if it's being scheduled at a later time. And that's kind of to be the best process for, at least what we're seeing, to connect with people and then help them be prepared for an appointment. If you're having difficulties reaching people, we do ask that you are calling people at least 3 times. If you're calling folks, if you can, try and see if you contact them at different times of the day. So if you're calling them at 2 p.m., that may not be the best time for that person. You may want to call in the evening or on weekends. So that's something that you guys may be able to work out with your team on what that scheduling for calling is going to look like. And then we do have an option for messaging for text messages if folks feel like that's a viable way or a good way to get a hold of people. If we think that they just may not be answering their phone because it's an unknown phone number, as kind of a last support, a last resort to reach people. If you do not reach them, remember to leave a voicemail, your name, agency, what you're calling about. They're going to be providing free assistance and helping them apply for Medicaid health coverage. And we have, of course, a return phone number. Just only thing I want folks to be mindful of is to not have too much personal information or leave any personal information in a voicemail as well, which I don't think folks would. Any questions about that, the process, or for, I mean, they're phone calls. So we just want to make sure you guys felt like you had that framework to go off of. So of course, anything that you feel like you want to adjust, you feel like would work best for community, you are more than welcome to do so as well. All right.
Sean, this is
Yeah.
Teresa from Neon.
Go for it.
And
Go
I
for
had
it.
I had a question regarding the don'ts. You stated that information can't be shared outside your organization, and I just wanted to make sure that I have that clearly. So let's just say, so a member of Neon cannot share any information that we get from, let's say, a member of CAN or a member of ERCO. Is that what I'm understanding?
Oh, that's a good question.
I mean, because what I'm thinking is we may reach out to another organization for language assistance, and I just want to make sure that
True.
I understand that correctly.
That's thank you, Teresa. That's actually a really, really important clarification. I don't see any issue with talking to each other in order to provide maybe language support, but that's something that we can maybe look at and add clarification to that. Dina and Rosie, do you have anything that you want to add at all?
If it's being, so it's just assisted on by another organization, it's not moved to another organization?
Well, I guess that would just depend on what the client is comfortable with, you know. So myself, I'm bilingual, I speak English and Spanish, but if I'm reaching out to somebody who maybe speaks, you know, I'm going to use a term like broken English, but let's say speaks Yapese, and there's a Yapese translator maybe on one of the other teams, how would that work? I mean, could we transfer it? Or do we do a three-way call? What is suggested?
Well, Sean, wouldn't they have the same list?
They would not, no. So that's the point too, is that each organization would get a smaller version of the larger list. Nina, I know you had something you wanted to mention, so feel free to go for it as well.
Yeah, I was just going to make a suggestion that if you do need a language that's not available in your organization, offer the phone number to the other organization to the call, you know, to the client that you're calling.
Okay.
I'm not comfortable. I would not be comfortable having the information shared, you know, because once you pass that information off, you don't, you know, you no longer have that information securely. It's not that the other organization would purposely use it or leave it unattended, but you know, when you're given the original list, that's your responsibility. That's just my opinion.
Okay. Thank you, Nina. I really appreciate that perspective as well.
But if, Sean, if the other organization is can provide linguistic support, would it make sense to have the member go to that organization and have them submit a new authorization form?
Yeah, I think so. And I think, you know, it would be, you know, it could be something too as well, Teresa, if you are unable to support that individual. Part of my hope and goal as well is to try and break the list up as much as possible so that they're getting sent to organizations that have that language support to begin with. But if that does happen, I personally think it would be helpful to, as Nina mentioned, provide the phone number of the organization that does have the translator. If you are able to use translation services as well, or you can also notify within your tracking that you were unable to provide the language support, and we can look at it from our end as well and see what we can do. But I feel like I need to create a little bit more clarification around that just for you guys as well. So I'll have that added into your guys' toolkit and make sure that that's clear for you as well on what to do if that is happening. Does that sound okay?
Yeah, thank you. Thank you, Sean.
Yeah, really good question. Sorry that ended up being so complex.
But Sean, on Nina, to piggyback on what Nina said, if the member contacts an organization for language assistance specifically, then they can conference call right to the organ to let's say to Teresa for the actual application assistance, or no?
Honestly, I need to think about it.
Okay.
Yeah.
No worries. I was just checking.
Yeah, this is all, I just want to make sure that I'm not overpromised anything that I can't and haven't been approved to do. So I want to bring the question back if we can. So go for it, Kathleen.
Thank you. Hey, just to, I'm just thinking like if the names are sent to an organization that isn't able to provide that language support and to, it's December. I don't know when we'll get to talk to these folks, and it's going to be at the end of the month, and just to like follow the system is really can be a barrier for these community members. And so it's just easier to like do a three-way call to the next organization that can provide that language support and say, hey, are you comfortable? Can we call this other organization that may be able to provide language support in your native language, instead of like, okay, hold on, I'll get back to you. And then, you know what I mean?
Yep.
I'm just thinking about time frame.
Yeah, definitely, Kathleen. I totally agree with you. I'm trying to balance what I'm allowed and what I'm not allowed to do on my end as well. So we'll figure out, I think, a good workaround for folks that everyone's comfortable with, because I have to be sensitive too with the state agencies on how information is being shared. I don't think there's going to be a problem with doing something like that, but I just want to make sure that I talk to some of the folks that have been helping me with privacy information on OHA sites as well. I don't want to overpromise. Is that okay, guys?
I think that's a sound decision, Sean.
Yes, thank you.
Yeah. Okay. And Rosie, did you guys get that written down? Okay, thank you.
Yeah, I got the workaround. Yeah, and more clarification. So
awesome. Thank you. I know I have a partial sentence, but my brain is a little fried. I just want to make sure we capture that because it's really, really important. And it didn't come up in our first call, so I'm glad you guys brought it up. Again, this is one of those things like we're going to continually learn new things and figure out what's the best way to approach them. Sometimes as things come up in the moment. So I appreciate you guys being flexible and bearing with me. But I definitely want to do everything I can to make it easiest for community, of course, is my #1 goal. So awesome. All right. So let me continue here. So just going along with the phone call messaging talking points, I just know sometimes when you are diving into this work, it can be helpful to have things that you can reference back to, even if it's stuff you don't end up using in the future, but maybe for your first few calls are just feeling more comfortable with it. We do have some talking points about what Medicaid is, what coverage that they may have access to, benefits that they didn't have access to on Marketplace, such as, free rides and, assistance, getting dental care and things like that, as well as how similar it is to their Marketplace coverage if they have concerns about that, and letting them know why this change has happened and that their COFA premium assistance program is ending, and that's why we need to help move them over to Medicaid, because that may be the program that they're eligible for at this time. And then similarly, we just had a text message script. You guys can use this if you'd like, if you feel like it's something that would work with community. If not, that's okay, but it's helped to give you guys a framework message as well. So once you guys have connected with individuals, the next process is to do the actual one application and help them apply in the application portal. So we're gonna break it down into different steps. So there's going to be prior to the application, some tips and tricks to the application itself, and then what needs to happen after they've reached a determination for OHB. So the prior steps are, making sure that the community member really understands the process of applying for benefits, what you're going to be applying for, make sure they feel comfortable with everything, making sure that you are getting a authorized for community partner help, a consent form signed. You can get those signed virtually. If you guys have our Getting Started guide for community partners, you should have information on remote assistance as well. If folks need that, I can make sure that's available to them. Make sure that rights and responsibilities and notice of privacy practice is being reviewed as well. I have links to all of these documents in the toolkit. The goal was to try and help make sure you guys have everything you need all in one place. And one final thing that can be helpful prior to an application to make sure that someone knows that they may need some information is just helping to make sure they have all the proper documentation. So income information, immigration information, so I-94 or passport details for all their family members that are going to be on their application with them. One caveat thing that I want to mention is that, of course, that last piece there, that's not necessarily a reason to turn anyone away, but it helps them to make sure that the client is as prepared as possible to prevent the application from pending. I just, even after our first session, I got a call from one of the folks that had multiple complications with different pending complications for COFA. So as best as we can set folks up for success up front, well, we'll make this process smoother for people. In regards to the OHP application, I'm not going to go through the whole thing. There was one particular spot that I wanted to make sure that we touch on, is making sure that folks' immigration information is entered correctly. This is something that is a continued concern when community members call on their own to the eligibility center. Is sometimes people get put down as undocumented or as non-immigrants, and sometimes that can prevent people from getting the correct determination for full coverage. So when you're getting into the immigration section of an application, it will ask, is this individual a U.S. citizen or not? The answer is no. It's going to ask, does this applicant have any one of the following statuses? There's a long list, I didn't put them on here, but the status you guys are looking for is citizen of Compact of Free Association, Micronesia, Marshall Islands, and Palau. If that has to be what's selected, unless the individual is, has permanent residency or is a U.S. citizen and has another status. If not, and they're a non-immigrant COFA, that's the one we want to select. That's the only way that they're going to get determined correctly. If it gets put down as non-immigrant, they may end up with just emergency coverage instead of full benefits. It will ask you about country of origin. Just mark whatever the client says pertains to them. And for documentation type, we tried to list in preference ones that are easiest for OHA and their system to identify folks' immigration status. Is there I-94, a passport? I asked if even if it's expired, does that work? And they said just if anything that they have to enter that information if they don't have anything else, because we know that just because someone has an expired passport doesn't necessarily mean that you don't lose your COFA status because you have an expired passport. And then if there, of course, there's anything else other than the first two, I know that for 99% of the folks, it's going to be I-95, I-94 or a passport. I know that can be sometimes a barrier for folks to find or look up. So that's the reason why you have us, CPOP, as support, and so that we can help folks with their determination as well. Okay.
And we have some questions, John, on the chat.
Go for it.
So Ronica asked, can they have dual citizenship, U.S. and COFA?
I mean, yeah, if that's what their status is, then yeah. I mean, are you talking about like U.S. citizenship as well as
Like being a U.S. citizen and then COFA, is that right, Ronica? U.S.
They have dual citizenship like U.S. citizenship and Marshallese, can they still?
Oh yeah, no, definitely. And I apologize. Yeah, this is for folks that don't have any other status, so they just have their non-immigrant COFA status. Then we want to make sure to use the selection. If they are a U.S. citizen, when you come to that first question, if it says, "Are you a U.S. citizen?" and that's correct, then you answer yes, and they'll be usually good to go. That usually can be verified based off of. I mean, sometimes it'll ask for naturalization documentation as well if they're a U.S. citizen, and you just help them upload that as well. That should be perfect. Yeah, really good question, Ronica. And then what else was there, Rosie?
And then Kathleen said, COFA is actually not a country. Sean, can that be changed if that is what is reflected on the application?
Not at this point. I know that that's one of the things that we want to get changed, but in order to change the one system, it is extremely difficult. I know, Kathleen, we've had this conversation before. It is just, I've brought it up multiple times. It's just I haven't gotten pushed through as a priority yet. So right now, this is what we have to work with. But I totally agree with you that it is not written in the best way, and it's not correct statement, and it can be confusing. And that's the complication, is it can be confusing for folks. And that's why I have you here, to help folks get it entered correctly. I know that's not the answer we want, but eventually we'll get it changed, I'm hoping. All right, anything else, Rosie?
Yeah, so we have Ramon. Hi, Ramon. It says, I'm a dual citizen. I'm Peruvian American, and I applied as a US citizen. They needed my passport and or birth certificate. Can't remember which one, or if it was both. This was a while ago. So I'm thinking he's having to, you know, what he was asked for, even though he was a US citizen. And yeah, he's a dual citizen, but yet they needed his passport and or birth certificates.
Yeah, I'll have to double check on that. I'm, you know, of course, when you finish the application, it's going to say it'll say a RFI, or request for information, and it will let you know specifically what it's looking for. What we'll want to do is upload any documentation that proves what your status is, whether it means you're a U.S. citizen, from an island or the Compact of Free Association, anything that identifies that. It's going to be passport, I-94. If you're a U.S. citizen, it's going to be naturalization paperwork, birth certificate, U.S. passport. You can use any of those documentation. Great question, Ramon. All right, anything else, Rosie? No, okay, cool. All right, guys, awesome questions. I know that this is going to be a continued conversation. This is just kind of the overview, and then we'll be here to provide more support as folks need it as well. Okay. So one thing for y'all to know is, when you're going through the one application, some of you may be familiar with this already, but it is going to ask if they have any other health insurance. And in order to avoid inaccuracies with their eligibility determination, we have to enter their marketplace information. Even though I know that we're going to turn around and cancel it once we have approval of their Oregon Health Plan coverage, but under federal law, we're required to notify any other health benefit that they have access to at the moment. So you'll indicate that it is private medical insurance. And there'll be a few things it'll ask for: the insurance company name, who the policy holder is, so who the primary contact is for the policy on Marketplace, their policy numbers, that usually ends up being the policy number on their card, so their Kaiser card, their Pacific Source card, and we will need to enter that information. I know there are some organizations that were using a different pathway to support folks, but I've been told explicitly that we have to do it this way if we're going to go about it in the correct fashion. So I'll let you guys know too what other follow-up pieces we have in order to remove this information once we've confirmed that we've canceled their marketplace coverage. All right, so one thing that I also was asked by our policy team that can be supportive and helpful in making sure that their applications are processed successfully. There are a couple things. There's a miscellaneous document upload that will appear once you've submitted the application. It will say thank you for submitting, and then it will pop up if there's any required information that will pop up and say, hey, it'll tell you specific things that need to be uploaded. If it doesn't, you'll get a miscellaneous document upload. If you have assisted the individual over the phone or virtually, you are required to submit a consent form, the authorization for community partner help form. And if you can, upload any immigration documentation that you can at the time. It just really helps to smooth things over on the back end. If you can, it's okay. If it's not required, that's fine. But if you're able to, that can be really helpful. But if it's going to slow down any processing, it's okay. There's other ways to submit stuff. One thing to keep in mind is this miscellaneous document upload only appears once when you're going through the finalization of the application. So if you miss it or you click next, you can't go back to it. But that doesn't mean you're out of luck. You can always send information securely using the Oregon.benefits email and our secure email system, and you guys will have access to that information as well if you do need to follow up and send that in. So in regards to, I tried to blow it up a little bit. I apologize for it being blurry, but there's going to be that file section. You'll click browse. You'll be able to upload a document. In the comments, you'll want to indicate that it's, an immigration document or a consent form, authorization form. Click attach, upload anything else that you need, and once you're finished, you can click next, and that will finish up the application and will go into its final determination process. Once we have confirmed that someone has been approved for Oregon Health Plan, that usually will show up right after you finish the application. It will indicate if members have been approved for benefits or if there's information that is pending for. But once we have final approval that they have other medical coverage, Oregon Health Plan, or they may need to say have an extra step and go do an interview with the Aging and People with Disability Office, which means they have extra steps and they haven't quite got their determination yet. But for those that are falling into the under age 65 and don't have a disability, you can sometimes get the determination really quickly. There's some troubleshooting stuff that we can talk about afterwards as well, that is in your guys's toolkit. But the next step we have after we've gotten the OHP approval is to assist the member in canceling their marketplace coverage. So we just have the list here to call help. To either go to healthcare.gov and you can they can log into their account and they can cancel their benefits from there, or they can call the 1-800 number. Important thing to keep in mind is it has to be the member themselves that is doing this. You can be on the call with them when they're calling Marketplace, when they're doing this assistance, but it needs to be them that cancels their coverage, just to make sure that it's the correct person and correct individual that's requesting the cancellation. Usually you can select the date, so whatever was working best for the client, usually the earliest the better, so that we can move forward with their OHP coverage. Okay, let's see. Early select date, great.
Sean, I have a question about that. So if somebody applies for OHP, it usually is retroactive to the 1st of that month. Yeah. How does that work with Marketplace also being in play? I don't think I've ever had to do it before. Can we retroactively request like Marketplace be canceled to the beginning of the month? So they're not like dual covered, or how does that work?
You can. It's a fairly complex process. From my understanding, this is a really good question. Normally dual enrollment is not good, and Nina, feel free to chime in too if you have anything that you want to add. But when it comes to dual enrollment, it's based off of their eligibility letter. So the date in which they receive their eligibility letter and the month afterwards, if they continue to have dual coverage going forward, that's when it becomes a problem.
So,
okay, thank you.
When you call healthcare.gov and you ask to have the plan canceled, they will not retro terminate. They will cancel it today. They will cancel it in a future date, but they will not retro terminate.
Yeah. Thank you, Nina. I appreciate it. Thank you for clarifying on that. So yeah, but that as long as we're following this process and working with community members, it shouldn't be an issue as long as we're following the steps of getting them off as quickly as possible with Marketplace. Usually 1 month of dual enrollment is not a problem, but we want to minimize that as much as possible. Because the other thing too is that some of these folks that have had COWM or emergency coverage since December, their benefits will be retroed back to December of last year. But that retro coverage should not be should not create a complication because their eligibility didn't change until they receive their eligibility notice, and that's how they notify and start that kind of the clock ticking of dual enrollment. Does that help?
It does. Thank you.
Awesome. Perfect. Sorry, I can get really long-winded and just keep talking. Hopefully that was helpful. And that's a really good question too. So make sure that that is spelled out in the toolkit as well. That's a really good question to bring up because I figured someone would bring that up. Okay. Anything else, Rosie or Dina, before I move on?
No, you covered that pretty good on my behalf. Dina, do you have anything to add?
Nothing from me.
Cool, awesome. Thanks, guys. Okay, great. Well, okay, there we go. So once we have the end date of the marketplace coverage, the next thing is to turn around and report a change within the client's one applicant portal and end that coverage and let them know that the marketplace coverage is no longer, or when the end date is. So you'll go back into and sign into your one applicant portal, go to your search for your customers, put in the client's name, date of birth. The submitted date is usually helpful to switch to all time. Once you're able to get to that client's dashboard, you will click report a change in circumstances. There will be an option that specifically says add or update health insurance policy. You want to make sure that that option is selected before you move forward, because that means that that will bring you to that portion of the application versus having you click through the whole thing. So just make sure you indicate, unless of course the client doesn't, if they have anything else that needs to be reported, of course help them with that as well. But if it's just the removal of their marketplace coverage or secondary private health insurance, you can just select that option. On that page, there will be an option that says, has this coverage ended? And click that button and enter in the end date for the coverage. Click through the rest of the application and submit it. And that way, we've done our due diligence to notify OHA that they had coverage and that it officially ended and they have no other health insurance offered to them other than Medicaid at the time. Okay. There is one last step to this as well that we'll chat about here briefly, and there'll be more information on it as well on how to do urgent cases in this regards and within your toolkit that we'll go over at the end. But one last thing, and that can help to expedite and push along the process of getting that insurance removed, is going to report tpl.org or Borg. And that is the group Health Insurance Group, or the HIG, manages that website. They are the ones that help to manage all health insurance and secondary health insurance that an Oregonian on the Oregon Health Plan has. They will be the ones that can help and assist with the final removal. So there is at their website an option to submit that private health insurance removal. So when you go to that, it's fairly straightforward. There is a template in your toolkit that lets you know usually the information that's needed in order to submit that successfully. You could do that on behalf of the client. There's an option that says you are an assister and you are helping, or they can do it on their own. I'm assuming the majority of us will probably be helping folks with it. The insurance reporting application link right there will take you right to the application. So you'll have this as well, and it'll be the toolkit too. If someone has urgent needs or urgent medical needs, medication needs, you can submit urgent requests to they have an email, or you can call them directly. And I have actually just earlier today, I was checking up on some messaging. Our staff recognize that this causes and creates some barriers. So as we're going through this process, please let me know continued complications that you guys are running into, because that helps me to push and advocate for them to adjust the way that they're allowing us to do this. And they've at least indicated that we might be able to find some flexibilities around it as well. So hopefully it'll become easier for us. But that is the entire process for the whole thing. Your phone outreach, contacting them, completing the application, disenrolling them from Marketplace, and removing Marketplace information from their one applicant portal so that they will get enrolled in a CCO or coordinated care organization.
And Sean, we had a good question from Kathleen, and I just want to share with everybody. I know they have access to the chat, but Kathleen asked, the end date would be the day that we are updating the change, correct?
The end date will be the date that you tell them, or the client tells Marketplace. So when you call Marketplace, you can give them a specific date. You can say, I want this to end now or tomorrow, or I want this to end at the end of the week. Whatever that date is that the client chooses, or you choose with them, that is the end date that you will put in your update in the One Applicant portal. Really good question. I know there's so much like processing stuff. You're just like, well, where do I put what? Where goes where? So yeah. And any other questions or concerns, guys?
No,
Sure.
that was everything. I just
Was it-
added on there
Okay.
that we will need to have that date to turn around and update the change. So
Awesome, guys. Great. And again, I want to make sure I'm not rushing through this too quickly. So definitely let me know. I can sometimes talk really quickly. So just let me know if that's an issue at all. So,
Sean, hi, this is Teresa. I have a
Oh, Teresa?
question
yeah,
regarding the TPL.
yeah.
So when the marketplace health plan that information is inputted into the one system,
Mhm.
that automatically goes onto this TPL, is that right? However, when you remove it, it does not come off automatically.
Yeah, so you're talking about yes. So that's why there's that extra step of having to contact the HIG directly when we're removing it. Does that make sense?
Yes, no, it does. I was just, because right now that I'm looking at this little rectangle that says private health insurance to add, update, or remove, I just wanted to make sure that when we add the marketplace on the one system, when we're applying for OHP,
Yep.
that we don't have to go on to report TPL and like input that information there as well.
That is a great question. Thank you for that clarification. I apologize. I pulled this image directly from their website, and I find it confusing as well, where it says add, update, or remove. So for our purposes, and we'll make sure that this is clear, you will enter the marketplace information into the One Applicant portal only to notify them that they have this insurance. When it comes to removal of that, you will update it in the One Applicant portal as well as contact the HIG. I know, guys. Yeah. So does that help, Teresa?
Yeah, it did. It
Okay.
did. Thank you. I was just like looking at this and I just got, okay, to add, update, or remove. Okay, I just want to make sure.
Yeah. And the reason why they state it that way is because technically this is a public website that anyone can use. So if someone didn't have access to the One Applicant portal and they were their own individual, they could technically just go to that link and add it there. But since you guys are already going to be going through the One Applicant portal, it makes sense for you just to add it into there first. And that will follow all the procedures that assisters, it will make most sense for assisters versus sometimes the general public. One thing too that I just want to keep folks aware of. So when it really comes to urgent medical needs, it is really any need that person is prevented from getting care that they need. So urgent medical care, urgent prescriptions, dialysis, anything where they need to have that care, that is considered an urgent case. They don't need any more details other than you indicating that it is urgent. So make sure, and there is that email template, make sure you are following up with these cases. And because from what I've been notified, OHA is a little bit behind in processing. It can take upwards to 30 days for them to remove TPL or remove secondary health insurance. So if someone does have urgent medical needs, we're going to need your guys' support to help them remove that.
Okay,
Yeah.
so this is Teresa again. So let's just say I'm at an outreach event and I'm assisting somebody. So the first step I'm going to do is apply for OHP.
Mm-hmm.
I'm going to put in their marketplace health plan, then call marketplace, cancel that marketplace health plan, then go back into the one system, and I'm going to remove the insurance that I put in prior.
Yep.
And then I'm going to go on to report TPL, and I'll either call or I'll input the information on their system.
Yep.
Is that right? And can I do that like consecutively, or do I have to wait a day?
I wouldn't wait personally at all.
Okay.
I feel the faster you do it, the better.
Okay.
Yeah. And again, this is, and I have voiced to folks the barriers that this will create and how this will slow down care. So, and access to care. So as much as you guys can keep me up to date on how things are going, whether this is working or not working, please keep me posted, because I can turn around and advocate and say, this is not working, we need something different, and we'll see what we can do. This is just the procedure I've been told to follow at the moment. All right, guys, anything else before I move on? Really, really good questions, guys, and I appreciate it. And I appreciate you asking for the clarity. It's really important. I want you guys to feel confident about what you're doing now. But again, follow up if anything else that you need. So once the private health insurance is fully removed, that person is rearing and ready to go to get signed up for their enrolled into their CCO. That can take that can also take 1 to 2 weeks. So similar situation, if someone has urgent medical needs, there is a process for expediting enrollment into a CCO if it's needed. These individuals will have that OHP open card, which many clinics and hospitals accept open cards. They will most likely be able to get the care that they need. But I have had situations where, say it was an example of dialysis, where a specific health plan within HealthShare was the only one that they could bill. And so we needed to expedite CCO enrollment. So again, that's another thing that we can help support with, and making sure that you guys feel confident in what you're doing. And I can help with that as well. I created a list of the majority of the CCOs that the folks that we are enrolling will be working with. Mass majority is going to be EOCCO in Eastern Oregon, Pacific Source in the Willamette Valley, and HealthShare within the metro region. Trillium also is a CCO option within the metro region. So that's going to be Multnomah, Clackamas, and Washington County. Right now, they are not an option. They are under what's called a corrective action plan with OHA. They're still offering health insurance and still offering all the care for people that are currently enrolled in their plan. But as of the 8th, you will not see them as an option on the OHP application. That doesn't necessarily mean that that's going to be forever. As long as they complete the things that are on the corrective action plans, we'll keep you up to date on how things change. But right now, HealthShare is going to be the only option available within the metro region. As I mentioned in the previous call, if there is someone that has to be on Trillium, there's a specific care need or something, and they just cannot be served by HealthShare, let me know, and we will see what we can work out and figure out to get them onto the proper CCO if they need it. There are a couple outliers as well. So for the couple folks that are on the coast and Benton County, and maybe potentially some folks in Polk, they may be working with Yamhill Community Care, Columbia Pacific CCO, or Intercommunity Health Network CCO. I do have a link there, the CCO contact information list, that has a list of all of the CCO's contact information, their handbooks, the major hospitals that they contract with, for you guys to kind of have a support, especially since some of you may be getting folks on your list that are not necessarily in your region, because we have so many people say to reach in Willamette. You know, I might be sharing names for folks that are outside of the Willamette Valley area, but we may need support reaching out to them, because there's like 173 people in Willamette, so we're definitely going to be trying to share the load. I included just a map of Oregon and where all the CCOs fall, just so you guys have that if you happen to have any outliers, but the hope and the goal is to try and to track that ahead of time so you kind of know who you might be working with. I know also that, at least in today's discussion, I'm not going to have a whole lot of time to dive deep into care coordination. But if you guys need support with that, or system navigation support in helping clients getting with primary care doctors, getting support and help for their CCOs, language assistance, all that kind of stuff, is things that we'll continue to help to support these community members with. And I can help to answer questions in those regards as well. But kind of the hope and goal of today's really was to talk about reaching them by phone, getting them enrolled and off of Marketplace. That's our biggest goal. And of course, continued support. And that's why you guys do all this work. All right. The next thing we're going to talk about is tracking and reporting your progress. So one thing that we're going to be doing is there is that, as I mentioned, an Excel spreadsheet that you're going to get. We're going to go over it here in a second. You can help track where you are in contacting individuals, scheduling appointments, where you are in their application enrollment, and where you are in their marketplace room disenrollment. They'll have different statuses and notes where you guys can keep information. And then the goal is for you to send a weekly report from your organization to me, of course, securely, so that I can have a master sheet on my end that I'm keeping track of all of the progress to these cases. All right, so let me pop out of here and we're going to go into the Excel spreadsheets. So, all right, we have 2 tabs. So there is going to be an instructions section. They're pretty basic instructions, but it's just to help you guys kind of orient yourself and feel comfortable with what's going on. There are some drop-down options that you guys can choose, and I'll show where those correspond to in the outreach list where you'll have everybody's names. I just have a few examples here of what kind of notes that you might want to take so that we can keep track of where we are. So there's going to be the phone outreach status, Medicaid enrollment status, and marketplace disenrollment status. There's a couple more things I have to add, but when you guys get this into, everything will be completed and polished. With the outreach list itself, I just added in a few examples for us to kind of go over. So you will receive a list with the first, last phone and language preference. Again, when it comes to language, it's not necessarily that they may need that, but what I try to do is identify ahead of time a potential language need, so that you guys feel as best prepared in sharing the information across your teams. It doesn't necessarily mean that everyone will 100% need that. It's just something for you to be aware of ahead of time. Because all I really had access to, thankfully that Nina had this information, is country of origin. Okay. So take an example here. So if we have got Sean Snyder, his phone number, his language need, under phone outreach status there, when you click into one of these boxes, there's a drop down arrow that will show up. You guys can choose from any one of these options to kind of signify where you're at. So for this individual, it was their second time that you've reached out to them. You left a voicemail on, December 7th. And then I know this is the future, this hasn't happened yet, but you left a voicemail on the 9th as well. So you're at your second call, haven't been able to reach them yet. John, you were able to connect with them and you were able to schedule an appointment and when their appointment is. So let's say we continue with John. You meet with him and you help him with his application. He shows up to his appointment. And so you can indicate, missed the appointment, application was started but not finished. Application submitted, but it's pending information. Agency review. Sometimes that can happen when a name doesn't match their social security card. Sometimes that can happen within our system. Or say they're age 65 and older and they're pending, waiting for a APD interview or for eligibility. Or medical approval. This is what we want. Medical approval. Yay! Then feel free to take any notes. So there's a section here that's kind of encompasses both Medicaid and marketplace disenrollment. Feel free to take any notes that you feel are helpful. You can also talk about any complications you ran into as well. We could talk about seeing whether we want to put another spot for that, you guys, to track that kind of experiences or roadblocks that you're running into. Not that you will, but I know it's helpful to keep a record of that so that we can see. In regards to marketplace disenrollment, there isn't going to be a whole lot of options for this drop down. I'm going to add those in. It's either going to say has not started or has been disenrolled. Since that of all the pieces, the marketplace disenrollment is probably going to be one of the easiest. And then I have a section here for you guys to assign it to an assister within your team. I know that it's going to be a lot of folks, and depending on language need, you're going to want to split it up. But that way, folks will be able to filter by their names. So say, I'm going to be making my calls today. I can go into this, there's a drop-down arrow. I can select my name only, and then that will just show my current list of the folks that I'm reaching out to. And if you ever need to unfilter, you just go back in, select all, okay. And you'll be able to see the whole list again. So just a helpful way for you to be a little bit more visual and not be so overwhelming, because that can be as well. Any kind of questions or concerns about the outreach member list template?
Sean, this is Lisa.
Go for Lisa.
So you're going to have a master for yourself and then give each organization their own list of names, and then we need to manage and then report back to you. Okay, got it. So
Yep.
would you rather have a one person report back to you, accumulate all the information from the staff and then report back to you as one?
That would,
Okay,
yeah, that would be preferred. If it's causing a lot of complications, let me know and we'll figure it out.
okay, no, I think we'll be good with that. It's just, in the past, I've worked with master lists, and when you have too many hands on a master list, then the list gets so messed up.
Yep, that's why access to master list is me.
Okay, cool. I
Yeah.
got it. Thank
Yeah,
you so much.
Of course, no worries. Great question. Anything else, guys, or any other concerns, thoughts? Two, if you start using this and you're like, Sean, this is garbage, I really need XYZ, let me know and we can update it, adjust it, if things aren't working for you guys as well.
Hey, Sean. So, hi, Teresa. Thank you for your question. There is a question. There's a couple of them. So Teresa says that there's an issue with the one system when reporting other insurance. If a client is not paying a premium, the one system does not allow you to move forward with the application unless a premium amount is entered.
Yeah, there's an option on that part that says, I don't know, like you don't know the price.
Yeah.
I've tried to click it, it turns red and it does not let you move forward with the application. I've tried to put zeros. I don't know what the issue is with the one system. I mean, I've had people who through their employer, they don't have a premium cost for their insurance, their other insurance. So they don't have a cost, but it will not let me move forward and I have to call the CP line for assistance.
Okay, and that is a really, really important thing to know about. Thank you, Teresa. And it doesn't let you put a $0 amount in?
It doesn't let you put a zero amount. It doesn't let you click, because there is it says, I don't know, and you can choose that option. It doesn't allow you to choose that either.
Okay.
I believe, I don't know if I think it was one of my coworkers, Holly, she tried to even put in $1 to see if it would go. It will not go.
Weird. Okay,
And
that's
if I can add, I know I had another CP with the same issue, but they were able to put $1 and move forward. And so this was already brought up to policy, and they were requesting the case number just for them to look at it. So Teresa, if you remember that, you can send that to me and I can send that to policy for them to take a look at and see what's going on, but we didn't get any. Yeah.
Because and the only reason that I bring it up is because a lot of, well, not a lot, I'll just say some people who were on the premium assistance program, they didn't pay for their premium.
Yeah.
So it's going to be zero. And then we're not going to be able to move forward with the application if, you know, the system is asking for an amount and I'm not able to put one in.
Yeah. That's okay. Yeah, I'll definitely have to look. We'll definitely have to look into that. Yeah. So if you have any of those cases, you're able to send to us, Teresa. Definitely want to try and get that resolved ASAP, because it's going to create a complication real fast. Okay. Well, thank you for letting me know. And we'll follow up with you on it. Thank you, Rosie, for helping with that. And I'm glad that's at least already been brought up before. Honestly, I'm surprised it hasn't come up. If that's a complication for other folks, why that hasn't come up more frequently. But I'm glad we know of it now. All right. Any other stuff, folks?
Yeah, there was another comment from Pamela. No questions regarding the template, but since I am new and not yet have my assister ID, can I still do the marketplace and get access to the system to disenroll people, referring to the one system?
Yeah, so and I know that some of the folks in CAN, you guys have not completed everything and don't have your assister ID. You should not be assisting with this work until you have your assister ID. From my understanding, I can double check on that, but at this moment, I'm fairly sure that we wouldn't feel comfortable having folks calling and disenrolling if you didn't have an assister ID yet.
Well, they'd be skipping steps, Sean, that they would need to input into the system. in order to call, correct?
Yeah, I think Pam was also thinking like if she could provide support with at least that call as well. You know, say if they're balancing that between their team. So I'll double check, but I'm fairly sure it's going to be a no. Just for yeah, I'm pretty sure that's going to be probably a no. So actually, in regards to some CAN folks that are on the call, if you don't have your sister ID yet, there's an email sent to you saying that you may not have responded to an email that helps to initiate your guys' application creation. We could talk about it at our check-in tomorrow, but you should have received an email if that's one of you guys. That I think Ramon helped to initiate that email. We need to get that taken care of ASAP so you guys can move forward in the process. All right, guys. Any other questions? Sweet. Okay, cool. Great question, guys. Let's get back into here. We are super close to being done. Where are we at on time? 6:45. Okay. So the last thing that we were going to talk about is project timeline. Again, this is just goals that I have. This may not be a reality and this may not be the way things work, but it just helps us to kind of think about where we are and what we are trying to attempt in a relatively short amount of time, which I totally understand. You guys will hopefully get your lists at the latest by Thursday. There are a few things that I'm finalizing. Once you have your list and you can even start discussing this now, how you guys are going to do your schedule within your organization. When are you going to be calling? And balance all of that work within your team so that you're managing it well. Begin phone outreach. We're hoping by Friday, December 12th. I'm hoping that we'll be able to complete reaching out to every member by the end of this year. And that hopefully we will at least have been able to schedule appointments and get people enrolled by the end of January. This is my thought. We'll most likely have a check-in with all the organizations in January to see where we are and see if there's any other things that we need to do, targeted outreach, if there maybe is a specific region where we're having a hard time reaching people. We'll discuss that at that time and see where we're at and what's going on. As well as I'd love to offer to for any organizations if they would like to do bi-weekly check-ins with me about the project and where you are. I'm here to provide support. So it's not a requirement, but if you guys feel like you need that check-in or you want to talk to me about issues or want to talk to me about how things are going, feel free to let me know if that would be helpful to you. I know for CAN, I have a meeting with you guys weekly, so we could use that as our check-in as well. So for other folks like Teresa from Neon, if you and Holly need that support, let me know. Oh, and Vian as well. I think Vian's on here too, from Mirko, you and Tay. I'm happy to meet with you guys more frequently. All right. Before we go into the toolkit, I just want to check in. We're at the end of our orientation and training. Any other pressing questions that have come up for folks? Anything that you felt like you hung on to and you want to ask it now?
Sean, I have a question. Just a quick one. Maybe I missed it because I came in late. But
no worries, Barry. Go for it.
So some of our community members, my experience, they actually didn't know if their marketplace, the COFA premium, is still active. So how do I
if
find
you are
out that?
Yeah, that's a great question. If you're receiving the list, they're active.
Okay. Yep. So we're just talking about those people on the list, right?
Yep, that's all we're reaching out to. There are 279 folks left on that are showing as active on the COFA Premium Assistance Program. Nina gets a updated list from OHP or from the Oregon Health Authority every week, notifying her of any new COFA members that need to be disenrolled from her program. So the 279 folks is up to date as of today. There may be a handful of people that maybe get processed before you get to them, but it's probably going to be pretty rare.
Thank you.
Yeah, no worries. Great question, Barry. All right, go for it, Kathleen.
Okay, sorry. I know that we just went through this PowerPoint set, but I just want to make sure because I already have community members calling me that they received a letter, and I want to make sure that I'm understanding the process. So I call, and the whole point is to get them off of the COFA Premium Assistance Program and then enroll them in the one system? No. Okay.
We want to, yeah. So first step is consent form and enrolling them in the Oregon Health Plan. Once you have a determination that yes, they are enrolled in Oregon Health Plan or other Medicaid benefits, that's when you disenroll them from Marketplace. And I confirmed with my policy that they want us to approach it this way. Under normal circumstances, I feel like it's usually better for someone to report a change within Marketplace and let the Marketplace system refer the applicant back to OHA. But guys, they are so behind. If we go that route and let that referral come from Marketplace to OHP, we're looking at a month to two before they get enrolled. So this is the way that we can expedite that enrollment into OHP and then help them disenroll from Marketplace.
Okay, let me say consent form, enroll in OHP, then ask the questions to determine if we need to disenroll from Marketplace.
They all have active Marketplace benefits. They all need to disenroll.
Okay, got it. Thank you.
So no worries. And honestly too, if you meet a community member that you're unsure of and they believe they may have Marketplace coverage, feel free to support them and see if they might need to disenroll, because there could be some folks that were part of that automated rollover in March that they may not have disenrolled from their Marketplace coverage. We notified them to do so, but I mean, I know that can be complicated as well. All right, go for it, Ronica.
Sean, did you say you were gonna email us a cheat sheet with the ones? Okay.
Yes. Yeah. Let's go over that. Let's go over that right now, just to make sure that we have time. And there are a couple things that we're finishing up, but it's pretty darn close. So my hope with Dina's and Rosie's support. Oop, that's what I wanted about. Go away. All right, is to have all of the tools and things that you need all in one place. So that's the hope for this toolkit. If we notice anything's missing, just let me know and we can always add it in. And Vienne, I think I saw you with your hand up as well. Do you have any other questions?
Oh yeah, so I'm so sorry that I'm late. So I missed some of the information. So can you hear me?
Yeah, we can hear you.
Yeah. So I just want to ask, like, I know that like you guys all have the list of the COFA member that we need to reach out to.
Mm-hmm.
But like I just want to ask for some case, like if the list member have like some COFA member that over 65 years old,
mm-hmm.
and they're not qualified for full benefit from Oregon Health Plan. And so like what should we do in this case? So if we not successfully like enroll them to Oregon Health Plan, you know, kind of things.
Yeah, that's great. Thank you, Vienne. That's a really good question. So I did mention this briefly, and that's one of the things I'm going to add into the toolkit that I wasn't able to get in today. There are a few extra steps for folks that are age 65 or long-term disability. When you're walking them through the One Applicant portal, it should identify them as fitting into one of those eligibility groups. When you complete an application, it is going to notify you. I think it takes a little bit of time, but it should show you that they are pending for an interview. So if you run into anybody that is age 65 or older, or somebody that indicates that they have potential long-term care needs, then they're most likely going to fall into the needing an interview with the Aging and People with Disability Office. And there is a phone number that you can provide to them or call on behalf with them to help them with their getting their interview set up properly. Other than that, there isn't a whole lot of extra stuff that you can do. If they haven't yet enrolled in, say, Medicare, then that's sometimes when you can get people connected with the Social Security Administration and connected with folks like the Senior Health Insurance Benefits Assistance Program, or SHEBA, as well. Can be a resource that can help folks with actual enrollment. That is a very difficult process, and you guys are not trained to help with Medicare in that sense, but you can at least help them be identified for financial assistance through Medicare, and then the Aging and People with a Disability Office will also help them with their Medicare enrollment too. They have a what's called the APD buy-in unit that helps people with those enrollments as well. Does that help it, Vian? I'm going to try and put together a little toolkit for our age 65 folks.
Yeah.
Okay, perfect. And I know that a lot of assisters have had complications with assisting folks that are age 65 or older. So again, just keep me involved. It is a handful of individuals that they're going to fall into that category. I think roughly 50 to 52 people. So it's a chunk, but that's just based off of folks' birthday. So you'll be able to identify pretty quickly if they're age 65 or older, just based on their information, and that they're going to fall into that category. But really good question. Anything else, guys, before I dive into the toolkit?
Yeah, Kathleen asked if there was a long-term care, if there's a list of what long-term care looks like. I just want to make sure that I know what that would entail.
There's just going to be 2 questions on the application that are asking, does this person need assistance with walking, bathing, things like that? If they answer yes to that question, that will identify them as being potentially eligible for long-term care services. There are two questions within the application, from my understanding, that will trigger a determination for them to be followed up with for long-term care services. And that should be all that you need to do. The majority of folks that usually handles it, unless Rosie or Dean, if you want to add anything else to that.
Oh, you got it.
Yeah, I don't think I need, nothing more to add. There was another really good question from Ramon. Will APD need a rejection letter from OHP to apply someone for Medicare? So that would be a no.
Nope, that's they won't, thankfully. We shouldn't need any denial letters. That's why, thankfully, why we now have an integrated eligibility system, is that it can communicate within itself, and it should be able to help with that determination. I think the one application system helps to determine people for like 47 different medical programs within the state. It's an insane amount, but it can't help them enroll in Medicare, but it will help assess them for what's called full dual eligibility, where they can have Medicare and full OHP coverage, or Medicare savings programs where they get assistance for paying for their monthly premiums with Medicare. So we'll want to pair them along with getting them connected with Social Security Administration or with SHIBA to make sure that they're fulfilling that enrollment in Medicare as well. Great questions, guys. All right, let's go through the toolkit a little bit here, and then if any other questions come up, we'll answer them before we're done, okay?
Really quick, since we were already on the topic. So if they are 65 and older, do we end the application process?
Do you end the application process?
Yeah, that's what it would say. So we don't end
Nope.
we will never end the application because they're 65 and older. No.
Yep. You can assist anyone through the applicant portal regardless of age. It should properly determine them for Medicare programs or Oregon Health Plan for anyone that's younger than 65 as well. So definitely complete the application, because that's how that initiates that referral to the APD office. So it's really, really important that we complete that. And that way they're connected to you, so that if they need support, they can come back to you as well. And then we can work together if there's anything extra that we can do to help them with that process. Because it is, unfortunately, can be complex. Good questions, guys. Awesome. And again, as these things come up, they will, as you're going through this, never hesitate to ask. You've got my email, got my contact information. Rosie, Tina, and myself are here to provide support, and Nina as well, if there's any Medicare questions that are coming up. We really do want to make sure that you guys feel supported. Okay, diving into the toolkit. So some of the stuff is not quite finished yet because I'm just laying out the last pieces. But this is where we have your phone call message guide. Go through the steps that we talked about today in the presentation, as well as a few extra details that we kind of left out of the presentation just to make sure that we got through everything. It will have information on how to, what to do if you're not able to reach people, the suggested text information if you're going to send someone a text message. It has application prep resources. So I know for a lot of folks, especially for COFA community members, they oftentimes may have their niece or nephew in their household, and it could get confusing on who goes on what application. So we do have a list here of who goes on an application, on the same application. And if anybody else doesn't fit into these categories, even if they're in the same household, they will most likely go on their own application. I've got a list here of what information may be needed for an application. So this is a checklist of all the things that may be necessary. They're not all 100% required, but the more information they can bring, the better. And it can prevent less pending if folks have all the information and details with them. This information here that says some medical programs will require the following, such as information about vehicles you own, homes, checking accounts, savings accounts. That's going to be your Medicare programs, Medicare-related programs and disability-related programs. They have other criteria and other eligibility criteria they have to assess. And that's what part of the interview is about, is assessing these other resources that they have access to. Then I have an application checklist. So things to do prior to your application. This is not going to be, so this is like, you know, logging into your account, making sure that you search for individuals. I know for CAN, you guys are new to this work, so you won't necessarily have a whole lot of people, but getting into the habit of searching for someone first before starting a new application is really good practice. So as you go along, you'll be doing this more commonly. And then this here is just helpful tips and tricks for COFA folks within an application. So really encouraging them to put in their preferred spoken language and written language that they would want, like a medical doctor to be speaking in or having access to. We really want to make sure that people are putting their language in, even if it's not an option right now, to put in other and, you know, type in Palauan or type in Pohnpeian if it's not an option. Because the more information we can gather, the easier it is for us to tell for the future. Then information on ending marketplace coverage, how to remove marketplace coverage from a one applicant applicant portal, and then removing third-party liability. Sorry, third-party liability is removing marketplace secondary coverage. Use with the health insurance group or the HIG. Then we have a client advocacy troubleshooting. This is where I have a few things that I need to add in, but troubleshooting a one application. So what if you find that the client already has a one applicant portal or one application, different ways to approach getting connected to that case. What if the application pens for an RFI and the client has urgent medical care, how to go about expediting those cases, supporting them. And then expediting the removal of private health insurance. So this is that template that we talked about earlier. So urgent cases with report TPL. This is some of the information that they would is helpful for them to have when you email the urgent case to them. So you'll in the subject line indicate that there's urgent medical needs. They let me know that if you're sending multiple emails that you need support with, that you just let them know how many emails they're going to be receiving from you to make sure that they're tracking all of them. And then we move into important documents. So I have your consent form, authorized rep and alternative payee, OHP application guide, rights, responsibilities, notice of privacy practice, the OHP paper application, and every language it's translated into for COFA community members. Anything that is blue and hyperlinked, you just you click control and click, and it will bring you right to the document. So my hope and goal was to make sure you guys had this all kind of at your fingertips when you're doing the work, so you're not having to hunt around for documents. So they're all going to be here. If for whatever reason a link doesn't work, you have the form number, and this is where you would go to look up those forms. So you have it all right there for you. For the secure emails, so when you guys are sending information to expedite cases, as I think we had someone ask in a previous call, getting connected to an active case. You've got your Oregon.benefits email and all the things you can use it for, pregnancy email line and newborn email line if that pertains to that particular family. So these three are the majority of what you'll need. There are a couple other emails, but they mostly won't pertain to this population, the community members. You will use the Oregon.benefits 99% of the time to get stuff done. Then we have the community partner email template. So when you're emailing secure information to to an eligibility worker to push a case through, this is the type of information that they want. So what are the complications and what are the things that we need to be fixing for the case? What is your information as an assister? What is the client's information? And that will help them successfully look up cases and get access to information and help expedite that. And then of course you would attach any extra documents as well. And then this is well important contacts. So I'm trying to put together all of the websites, phone numbers, fax numbers, everything that you guys will need to successfully do this work. And then in the section here, we'll have when you would be using that particular resource. So a couple more things that I'm finishing up, but I should be able to get it done before I send everything to you guys on Thursday. If not, I'll keep you up to date if something happens. But I think we've been making really good time, and I think we've been moving through this pretty quickly. So does anybody have any questions or concerns about the toolkit or anything else that's come up for folks?
Yeah, there was, Teresa, have the reps on the community partner line been informed that we may need assistance in expediting an application? Are they in the loop of things?
Yes, so that's a great question, Teresa. Over the last 3 weeks, I have been advocating with policy and with administration to get extra support. All I can indicate is that eligibility worker staff have been notified on multiple occasions, provided information on multiple occasions on what kind of support COFA community members need. In regards to me being able to get you guys extra access, like say you are able to put COFA in the subject line and then they expedite it, I haven't been able to get that kind of approval, unfortunately. But I think as if we gather information that there are lots of barriers, I can bring that to them and then that might help us push more. At this moment, I haven't been able to get it, but if you guys think 3 weeks ago, I wasn't even able to share any information with you. So sometimes we just got to keep greasing the squeaky wheel, if that's the right saying. And it helps. It just helps us move things forward. And again, it starts with you guys. And I just want to acknowledge this is a lot. It's been a lot for today, but y'all are fantastic. And I wouldn't be able to do this without you. So just really, really, really grateful. Oh, go for it, Lisa.
Okay, so I accidentally created a different username. Don't beat me with the wet noodle. I read it when because you wanted us to activate. So I didn't realize it's supposed to be CAN002 and I just did L Merrill and I tried to fix it and I can't.
No worries. That happens sometimes. That's not a problem at all. So why don't you go ahead and email me and let me know. I will forward that to Jamie and we'll help you get that fixed ASAP.
Okay, I'll do that. So sorry about that. When I was on the bad list, I was trying to fix it. Trying to get presents, so I was trying to get off the naughty list.
I love it. No worries. You're totally fine. It happens to a lot of folks, especially when you're new to this work and you're like, what am I doing? And you're like, well, this is the one I use. I probably in the last week or so have had 2 or 3 people that have done that under different teams across the area. So don't worry. Easy to fix.
Thank you.
Just keep an eye out for an email from Jamie. Sometimes they will ask for 100% approval from you to close that old account and restart it. So just keep an eye out if you do receive an email it'll come from cp.business@dhsoha. That's coming from Jamie from our business team. Never ignore any emails that comes from cp.business. They're usually extremely important emails, and it's the difference between you becoming an assistant or not, or keeping your certification stats and stuff like that. So awesome. All right, guys.
Who was it again, Sean? Sorry, who was it? We should not be ignoring their email.
Yeah, from cp.business.
Business. Thank you.
Yeah, it doesn't. Sometimes it comes across to people. They're just like, who is this? So it's just one of our other. We have community partner outreach, which is a generic email that sometimes folks can use when they're reaching out to us. And then cp.business release for our sisters. So if you're getting something from Jamie, it's important. Awesome. All right, guys. All right, time check 7:09. We finished early. Fantastic. I want to make sure though, before we head off, is there any other questions that folks have? Anything else that's come up for them?
Sean, just a quick question.
Go for Barry.
when we fill out that consent form, or the name changes, but it's same intention. So that person now it's gonna be under CAN. Let's say, because some of the people that I helped before, they wanna stick with me, but I moved from Rockwood CDC and moved to CAN. So
that's totally fine. All you need
Okay.
to do, all you need to do is have them fill out a new or authorization for community partner help consent form, and just do it under your new CAN ID, sister ID, and you can, if it's folks, say Perry, that have active benefits already, and you just want to help move them over, and they'd ask you for that that assistance, just get that signed with them over the phone, and then send an email to Orkin.benefits and let them know you need to get connected to their case. They'll just move you, your sister, over to CAM.
yeah, I've done that already. Thank you. Thank you, Sean.
Perfect. Awesome. Great. Yeah. Good, really good question. Any other last thoughts, guys?
Just one question, Sean.
Yeah.
So if like during the whole process, we have like urgent, I made a mistake. There's a number that we call, right? It listed in the toolkit.
Yep. So
Okay.
let's just take a look at it real quick here. It should be in here. Okay, so certified community partner resources, 1-800, the 888-865-0525 is your guys' phone number. When you call in, there are 3 different options. The first one is to get assistance with expediting or working and processing an application. Option 2 is getting connected to an open, you have a consent form and need to get connected to a case. The third option is if you're having tech support issues with your one applicant portal. Yeah. And then, yeah, absolutely. And then what I always say is, and this information is in the Getting Started guide as well. I just tried to kind of boil it down to a more simplified version that wasn't so long. Once you've tried that route, so you assisting a person, you have done their application, you run into a complication or you need to expedite a case, you go through the eligibility center, one customer service using your 888 number, and you're still running into barriers, come to me. Just send me a secure email, say, Sean, these are the steps I've taken. This person has urgent needs. Can you help me? I've already tried my normal route and I need support. Let me know. I have folks I can forward it on to and they'll fix it like that sometimes.
Thank you.
Yeah, absolutely. Yeah. The only thing that they do ask of us is that you guys do follow that triage first and you try all the resources you have available to you, and then they'll be able to provide support. It's just because they have capacity issues. We want to make sure that you're keeping value of their time as well. Awesome, guys. I feel like I'm not even making words that make sense at this time. I've been just it's been a long day. All right, anything else, guys? Really, really good questions. Y'all are awesome. Okay. Perfect. Okay, well, I'll just bring this up and say thank you. I'll go ahead and stop the recording so that we have that. I'm going to